what's your perception? Why there is so much gap among the healthcare? Forget about the public. Public is far away. We are not discussing the public part. But among the healthcare, there's a huge gap regarding their attitude toward the organ donation as well as the knowledge regarding the organ donation. Sir, what is your opinion regarding that?
So let me try and put it this way. In general, there is a reluctance to approach or discuss the topic of death in any situation. Brain death is a special situation where the discussion about brain death can actually be of benefit to many people if the patient turns out to be an organ donor. Unfortunately, people are not willing to broach the topic of death in any form to many people. It happens in transplant units, it happens in non-transplant units, and it happens across the board. And one of the problems is that if you in medical school, in your post-graduation, you're taught how to cure, how to treat.
Yeah.
We are not taught how to recognize death, and we are not taught what to do when you recognize that a patient is dying. You will ask any medical student, he'll give you all the indications for liver transplant. Which patient should be transplanted? What type of transplant should be done? Okay, how much liver should be is required for a successful transplant? But if you ask him, okay, so how will you approach a brain dead patient or the family of a brain dead patient for organ transplant? They will never know. They've never been taught that sort of thing. They've not been taught probably nuances of or not even the nuances, the basics of the transplantation of human organs and Tissues Act. So one is, I think that approach and teaching to medical care is very much oriented towards cure rather than towards recognizing and dealing with death, including brain death. Even when you have hospitals which have a large, say, a neuro workload where a lot of potential organ donors, some people are well tuned to it, but as a whole, the system is not well geared up. And one of the reasons may be, again, apart from the reluctance to discuss brain death, these are uncomfortable discussions. They are uncomfortable for doctors. They're sometimes uncomfortable for families. But actually, when you do these discussions, you find out they're not that difficult. And there are some units where I worked in where the transplant coordinator would come around every week and ask why 1, 2, 3, 4 patients who were eligible to become donors were not counseled for donation or did not land up being donors. So it sort of tunes the entire unit towards a culture where there is some sort of onus or some responsibility to take for making sure that at least the questions have been asked, at least the approaches have been made, and then whether it ultimately culminates in a successful donation or not is a secondary matter, but at least the groundwork needs to be done by all concerned. The other thing is, even if you talk, I'm not talking of intensivists and those who work in, in the transplant setting, but if you ask medical practitioners of different specialties, the concept of brain death is very nebulous. They will say someone who's got a stroke and who's vegetative, they'll call that person brain death. When you talk, they will say someone who's had who's deeply unconscious and in coma, but breathing and so on, they will say that this person is brain death. So I think the fact that brain death is a very specific medical entity is also not very well commonly appreciated or known across multiple specialties. If you ask general practitioners, and they are very important because they are the ones who the family will turn to for counseling or who will turn to for advice, they should be able to discuss brain death with full knowledge of what is brain death and what it entails. Right? So I think there are multiple barriers that we need to cross, but I think the first and foremost is within ourselves, and that culture of knowing that death is impending and what to do in a dying patient, whether he's for organ donation or whether he's not for organ donation. Either way, we need to know what to do when the patients are dying. And I think that is the basic sort of lacuna in our education and in our practice as well.